So continuing the class. So the diagnosis by the radiograph, vitality test, tracing of sinus tract, periodontal probing. Treatment by conventional endodontic therapy. Endodontic therapy only. And the differential diagnosis. Presence of large carious lesion or previous restoration close to the pulp. Patient may not have any periodontal disease in other areas of mouth. Tooth is non-vital and the narrow deep pocket. Upon endodontic treatment, the lesion heals rapidly. Primary endodontic lesion with secondary periodontal involvement. The characteristics: long-standing pulpal pathosis, accumulation of plaque and calculus leads further apical migration of attachment, generalized periodontal disease. And the diagnosis by radiograph, pulp vitality test, periodontal probing. Treatment by endodontic treatment, periodontal treatment. Periodontal treatment after 2 to 3 months. Primary periodontal lesion characteristics: tooth vital, generalized bone loss, calculus and plaque, soft tissue inflammation, broad-based pockets, mobility, periodontal abscess during acute phase. In the primary periodontal lesion, in cases that you can see that the calculus and plaque the presence, and the generalized mobility we can diagnose in the primary periodontal lesion. And the diagnosis by visual examination, by probing, pulp testing, and radiographs. And what is in the visual examination? That is in the visual examination by the when a generalized periodontal case by visual examination will make out that by a large deposit, plaque, calculus, or recession, and the enlargement, gingival marginal enlargement, and all we can make out by the visual examination. Treatment: periodontal therapy, root amputation, guided tissue regeneration. Because GTR is used because of there's a bone loss in the periodontal cases. Primary periodontal. Primary periodontal lesion with secondary endodontic involvement. Characteristics: deep periodontal in pockets, history of extensive periodontal procedures, irreversible pulpal pathosis. Symptoms: sensitivity to temperature, tenderness to percussion, mobility, and swelling. And the diagnosis: history of disease progression, probing, pulp testing, and radiograph changes. And the differential diagnosis: presence of generalized periodontal disease, failure of GP point to reach the apex, presence of pulp vitality. Treatment: periodontal therapy, root amputation, guided tissue regeneration, and endodontic therapy. Coming to the true complaint lesions. Characteristics: once the pulpal and periodontal lesions coalesce, they may be clinically indistinguishable. Necrotic pulp or failed endodontic treatment, plaque, calculus, and periodontitis will be present in varying degree. So the true complaint lesion, the pulpal and periodontal issue, the necrotic pulp or failed periodontal treatment with the deposits, calculus, plaque, and the periodontitis will be present. Generalized bone loss. Diagnosis: by probing, radiograph, and pulpal testing. Conventional endodontic therapy review after 4 to 6 months post-operative healing. Then by the treatment by the periodontal lesion and the phase 1 therapy and periodontal surgery. Phase 1 therapy scaling and root planing, then the periodontal surgery. So what is the prognosis of this each case's prognosis? Primary endodontic lesion, the prognosis is good. The prognosis of primary endodontic lesion, that is good. And the prognosis of primary periodontal lesion, that is the prognosis depending upon the periodontal treatment and patient response. So the primary periodontal lesion, the prognosis depends upon the periodontal treatment and what are the treatment we are giving and the patient response. And the primary endodontic secondary periodontal lesion, the prognosis depends upon the endodontic and periodontal treatment and patient response. So the primary endodontic and secondary periodontic, that is depending upon the treatment giving the endodontic therapy and the secondary the periodontal treatment and the patient response. Primary periodontal and secondary endodontic lesion. The prognosis. The prognosis depending on the severity of periodontal disease and periodontal tissue response to the treatment. So primary periodontal and secondary endodontic. So how much the periodontal disease affected and what treatment giving and the treatment response to the patient, response of the patient by the giving the treatment. So the primary endodontic lesion, the prognosis is good. Primary periodontal lesion, the prognosis depending upon the periodontal treatment. Primary endodontic and secondary periodontal lesion, the treatment depends upon the endodontic and periodontal treatment and the patient response. And primary periodontal and secondary endodontic lesion, that is prognosis depending upon the severity of the periodontal disease and periodontal tissue response to the treatment. So today we will see the endoperio lesion and the endoperio lesion, the pathways of communication, the anatomical pathway and the non-physiological pathways. And on anatomical pathways or developmental pathways, we see the apical foramen, axillary canals, and the tubular pathways and on. And the classification, we see the classification, the so many classification, and from that we selected the Simon Glick and Frank in 1972 classification. They classified into 5 types, and we see the treatment plan, what treatment giving for each lesion, and the prognosis of each lesion, and what are the diagnostic criteria. Diagnostic criteria, what are the vitality test, radiographic evaluation, and the pain and abscess formation, mobility, and the percussion and palpation. So endoperio lesion can be asked as a 5-mark question. So all of you detailing read that. Thank you.